New numbers show just how badly COVID is ravaging our nation's nursing homes. It is now estimated that residents and workers at nursing homes make up 1 out of every 3 coronavirus deaths in the United States. That is 28,000 Americans. Now, those figures, they're from the New York Times. The paper combed through the numbers to try and sort this out. The Times had to dig because the federal government still has not set up a mechanism to track the deaths in those facilities. Also, many experts say the number of fatalities is being severely undercounted. And now, President Trump announcing that the White House is calling for the testing of 1 million nursing home residents and staff over the next 2 weeks. Just about every day, we are seeing headlines about tragedies at both nursing homes and other long-term care facilities. For example, at a veterans home in Paramus, New Jersey, more than 70 residents have died from the virus. About 35 miles south of that, in Edison, a different home for vets had 55 virus-related fatalities. Just in New Jersey alone, 15 facilities, they've reported 30 or more deaths. 4 have lost more than 50 people. And that's just a single state. We've already told you about the Soldier Home in Holyoke, Massachusetts, where more than 70 residents died from COVID. New York is the epicenter of the nationwide outbreak, and the state's nursing homes have also been hit particularly hard, with more than 5,000 deaths statewide. Governor Andrew Cuomo has been getting generally high marks here for his handling of the outbreak, but one area where he's taking some heat is about nursing homes, especially after the state's health department required that nursing homes accept recovering COVID patients. But Cuomo now has announced to do a 180 and change those procedures completely. Take a listen to the governor yesterday.
All nursing home staff must now be tested twice a week. Hospitals, going forward, cannot discharge a patient to a nursing home unless the patient tests negative for COVID-19. So we're just not going to send a person who is positive to a nursing home after a hospital visit, period. So we have available COVID-only facilities that could accept nursing home residents.
My next guest recently wrote an opinion piece in the Times saying that nursing homes were a disaster waiting to happen long before this pandemic. Richard Moll, he's the executive director of the Long-Term Care Community Coalition. Richard, I'm curious, obviously this issue's been on your radar well before COVID, but do you reserve most of your frustration for the nursing homes themselves or for the federal and the state governments that basically let these people police themselves?
Frankly, both. I mean, nursing homes have a responsibility. The responsibility is really clear in terms of having adequate staff, in terms of protecting residents against infection and other issues that come into the nursing home. So the standards are good. It's up to them. They have a legal requirement to be fulfilling those standards, but it's, the fact that they don't with impunity is, from our perspective, a real problem. We now, as we just said, there's going to be widespread testing for nursing homes. Some states are already doing it. From the numbers that we've reported from just the small sampling that's taken place, it's jaw-dropping. How scared are you when we get the data back, just how bad it's going to be in these nursing homes and long-term care facilities? I think it has been, and it will continue to be, unfortunately, really bad. We were concerned from the outset that as you were saying, the failures of the nursing home industry to have the staffing in place, to have the infection prevention and protection protocols in place, to have basically be able to get away with substandard care as a result of poor federal and state oversight would or could possibly result in this being catastrophic for residents. And I think, unfortunately, we're starting to see that. And I think there's going to be a record of much more. And hopefully there'll be a reckoning to address this issue so it doesn't happen again. Richard, how much has this been complicated that since the pandemic, families haven't been able to go into the nursing homes to see loved ones, and this is basically, been relegated to word of mouth or just based off of trust without verification? I think it's a lot. We were so concerned at the very beginning, before it really spread in this country, that residents' family members and their loved ones were essentially being blockaded from nursing homes. Now, of course, in essence, it's kind of too late because so many facilities have infection in them. But at the time, at the very start, we were saying, you know what, we could have people come in a way that protects residents and protects their family members and still provide that oversight, the monitoring, even the care. So many residents, I actually didn't realize, even though I've worked in this area my entire career, so many residents they depend upon their family members just for help with feeding, to maintain basic nutrition and hydration, as well as other care assistance, and that is now absent.
You know, I've seen certain states, Richard, and we mentioned before, Governor Cuomo, I think, deserves high marks for how he's handled the pandemic, but the nursing homes, finally he's done a 180, and it's taken, I think, too long to finally get to this point, but there are ways that you can police nursing homes more than they have been. Certain states, I saw in Oregon, for example, there's the equivalent of a strike team that somebody from, the state troopers in effect. You have medical professionals from outside that are there, and they're not just trusting, they're looking for themselves. Shouldn't that be basically the standard across the board? And also, shouldn't we attach conditions to Medicare and Medicaid funding too, that they don't go into profits, they go into care?
Absolutely. But we were so glad and really inspired to see that some governors did come out with these strike forces. We actually adopted a lot of those, the governor's plans, for instance, in Maryland especially, into our own recommendations for New York and nationally, to have a strike force, to go in there, go into facilities, make sure that residents are safe, take care of those who are in need immediately, but also make sure that the facility is being appropriately administered, that there's good medical direction, that there's enough nursing staff, enough PPE, et cetera. So that is number one, and I think that was a really valuable and important idea, and we're glad to see that continue and rolling out in other states as well.
One of the things, and you've forgotten about more about this than I know, but I spoke recently to a nun, and in Maryknoll, for example, they lost 3 nuns, they lost as many as 8, and counting priests, and there's many more people that are impacted. We've seen it veteran home facilities. This isn't just the nursing homes. Anytime there's long-term care with seniors, this is spreading like wildfire. And my concern is, for some people, they're just getting their arms around it because there's been so much undercounting or underreporting of this. Have you found that yourself, that this is much more widespread than we even imagine?
I think, yeah, as you alluded to before, I think it's going to be much worse than we're actually seeing. The final numbers are going to be much worse. What's going on right now is going to be much worse. And that, in essence, also tells us we can take steps now, like the step that Governor Cuomo took here in New York to ameliorate the harm that is going on right now by making sure facilities have appropriate staffing, make sure that they have infection protocols in place. You had mentioned before, do I think that there should be ties to Medicare and Medicaid funding to make sure that residents have appropriate care. And absolutely, I mean, any other industry, you would expect that if you were getting money for services, that some of that money, a certain allocation, would have to go to actually providing those services. But for some reason, when it comes to providing care to nursing home residents, because the industry is so powerful, there's virtually no requirements around where that money goes. And that's why we've seen that this is made residents much more vulnerable than they needed to be to the pandemic.
And finally, I want to play a clip. This is from the Texas Lieutenant Governor, Dan Patrick, and he may have said out loud, unfortunately, what some people think in terms of that the value of a human life somehow mitigated if they're older.
No one reached out to me and said, as a senior citizen, are you willing to take a chance on your survival in exchange for keeping the America that all America loves for your children and grandchildren? And if that's the exchange, I'm all in.
Oh, first off, I'll speak for myself that he's an unmitigated moron, and it's also a false choice. But to me, Richard, is the dirty secret that there are people who think like him until it's their parent or it's their grandparent that they're cut off from, and they're just hoping that everything's okay? I mean, unfortunately, is he representing what a lot of people feel until it's one of their own?
I think that's exactly right. I think that people, just off the top of their head, they go, someone is older, they're going to die anyway. And I think we have a tremendous amount of long-standing discrimination against and disregard of people who are older, people with disabilities. But really importantly, the Trump administration has actually said, this was in late March, I believe, that it is against federal law to be discriminating against someone based upon their age or their disability.
Richard Moll, I appreciate it so much. Thank you so much for the time. All right, when we come back, everyone, farmers taking a massive financial hit due to all the shutdowns, even though they have a surplus of crops. Something's not adding up here. After the break, a farmer with an idea on how to help feed people who need it the most, he'll join us to discuss.